Are you aware of the early signs and symptoms of high blood pressure and hypertension? If no, welcome to my channel Clinical Me, where we talk information concerning our health. Please, if you are new to my channel, please click on the subscription and notification bell to see more of our video. High blood pressure, commonly known as hypertension, is a condition that silently affects millions of people worldwide. It is often called the silent killer, where it is known for lack of its obvious warning signs. Recognize hypertension symptoms early is essential to manage the condition and avoiding life-threatening complications. What is hypertension? Hypertension refers to elevated blood pressure level with reading of 140 and above systolic and 90 and above millimeters of mercury. The normal blood pressure should not be more than 120 to 80 mmHg. So between 120 to 80 for systolic and 80 to 90 diastolic blood pressure is high blood pressure. Note that hypertension can only be certain with an average of 2 or more seated BP reading at different time interval. This blood pressure measures the force of the blood pushing against the wall of your arteries, blood vessel. If this force remains constantly too high over a period of time, can cause damage to vital organs like heart, brain, and kidney. It and #039S can go unnoticed for years, living your normal life until it has done significant damage. That is why it is called silent killer disease. Knowing early symptoms of high BP can help you take proactive steps to safeguard your health by taking significant difference in early detection or diagnosis and treatment. When left untreated, hypertension can lead to severe complications such as heart attack, stroke, and kidney failure. Common hypertension symptoms to watch out for. One of the challenges in detecting hypertension is its asymptomatic nature. However, there are subtle warning symptoms that may or possibly indicate the onset of high blood pressure. These include 1. Persistent headache, which are often dull-like and occur at the back of your head, particularly in the morning. 2. Dizziness or lightheadedness, medically known as syncope, which is a fainting feeling, can also signal elevated blood pressure, especially if these symptoms occur frequently. 3. Having a blurred or double vision. 4. Fatigue or confusion. 5. Chest pain and shortness of breath, indicating struggling to pump blood effectively. Note, these symptoms should never be ignored if they occur constantly. Please, if you find this information is useful, click the subscription and notification bell to get more of my video. Let's continue. Risk factors you cannot ignore. Certain factors increases your risk of developing hypertension. These include 1. Age. The risk of high blood pressure increases as you get older. 2. Genetic. That is, a family with history or record of hypertension can make you more at risk. 3. Lifestyle features such as poor diet, lack of exercise, smoking, and excessive alcohol consumption. 4. Stress is another factor that can temporarily raise blood pressure level. Chronic stress combined with unhealthy coping mechanisms like overeating or smoking can lead to hypertension. 5. Obesity. Lifestyle change to manage or prevent hypertension. Adopting a healthy lifestyle is one of the most common ways to manage high pressure. A balanced diet rich in fruit, vegetable, whole grain, reducing salt intake, regular physical exercise aiming at least 30 minutes more than 4 to 5 days in a week, managing stress through medication, deep breathing, and yoga. Limit alcohol consumption and quitting smoking. These habits not only reduce your risk of hypertension but also improve your overall health. Note that the cause of 90% of people with hypertension is unknown, while the remaining 10% of people with hypertension is due to an underlying condition such as renal or kidney disorder, endocrine disorder, cardiovascular disorder, medication, and neurogenic disorder. Please, if any of these symptoms persist, go for medical checkup. Health is wealth.